Hey YouTube family! Welcome our channel, Dr. HubSpot. Like, share, and subscribe to see more useful content about health. Today, we're going to use the foot as a way of diagnosing the liver. And of course, my disclaimer here is that you are not really diagnosing a liver disease. You have to go to the doctor and have them do tests to figure that out. But this will give you some good clues on a potential problems with liver. That being said, let's go. These are just little indicators that can actually help you narrow things down. The first thing we're going to talk about is the little red and brown dots. They can be larger and smaller, and you can also have like little shininess to them. They are usually on the lower leg. That is poor circulation, and that is usually a liver problem. It could also be diabetes. It could be many other things, but you see this a lot when people have liver problems. So the actual appearance of the lower leg and the foot gives a lot of great information about the overall health of the person, because the heart has to send blood all the way down to your feet and then back through the vascular system. And usually, if there were a liver problem or heart problem, whatever, there is going to be a vascular problem, and you are going to see it in this part of your body a lot because the poor circulation that's occurring. So a lot of these problems happen at a greatest distance from the heart. And also, even with diabetes, for example, you see neurological problems in your feet, in your hands, because of that fact, because it affects the digital fingers, which is the point furthest away from the heart. So you will see red and brown little discoloration type specks on the lower leg, and then something called spider veins, or another name would be spider nevis, which usually see this in cirrhosis. And what's happening to the liver is you are building up a lot of estrogen, and too much estrogen can affect the vascular system. So you can see varicose veins and spider veins, and you can see them in the lower legs. Then we have cracked heels. This is usually a vitamin B3 deficiency or an omega-3 fatty acid deficiency. Why? Because one of the functions of the liver is to make bile and help you absorb these fatty acids. Not just omega-3 fatty acids, but vitamin A, which could be involved in the skin, vitamin E, which could be involved in the skin. Those are fat-soluble vitamins. But vitamin B3 also affect the skin. Other B vitamins also can affect the skin as well, just how they relate to the cofactor to help the enzyme work, especially with proteins. So B3 deficiency can create a problem. Another name for that would be pellagra. People with pellagra, which is B3 deficiency, have a lot of skin issues. Each of the foot